Hello everyone, welcome to the Thrive with Axe of May 2020. This is the 5th of 10 seminars in 2020 provided by the Rehab Department. We are presenting these seminars every month except for September this year, which is Active Aging Week, and December. So we hope that everyone is staying safe and healthy throughout the COVID virus, and we hope to see you guys all soon. So today's presentation is on strength, osteoarthritis, and chronic pain management. This month we will be focusing on the importance of strength exercising, educating you about osteoarthritis, a common problem in aging joints that worsens if muscles are weak. And finally, we will talk about a special program available to all the AXE residents living with chronic pain. Why is strength so important? This is a quote from Dr. Mary Tinetti, who is a famous physician and researcher. She studies older adults and has found that leg strength is the most important thing you can focus on to prevent having to go to a nursing home. The evidence shows that if you want to avoid falling, becoming disabled, or want to avoid having to go to OBT or Willebroek Court, your chances are better if you have good leg strength. We think this is a really powerful information. So just to read the quote from Dr. Tinetti, leg strength, not diagnosis, not cholesterol level, not age, not medication use, not any of these usual measurements, but leg strength alone was the single most powerful predictor as to whether a person was going to have to enter a nursing home. So, strength. Adults over the age of 50 naturally lose 1% of their muscle mass per year. If strengthening exercises are neglected, this loss equates to 1 to 3% of strength loss per year. Thus, someone who is 80 who does not exercise their muscles correctly can have over a 30% loss of strength. More bad news. The muscle fibers lost are the type of fibers that act quickly to keep us from falling. It is no wonder that there are so many falls amongst older adults. Strength training benefits. Strength training has many benefits. The type we recommend does not result in big muscles, so you don't have to worry about looking like the Incredible Hulk. Many residents are concerned about exercising due to their medical conditions like arthritis or spinal conditions. Exercise done correctly actually reduces arthritis pain and reduces back pain. We will go into more detail about how strengthening and flexibility exercises specifically help arthritis. But there are many, many benefits of strength training. Effective strengthening exercises improve muscle function and endurance, giving you more stability and energy throughout the day. Strong muscles can reduce disability and help preserve bones, support your joints, and decrease pain. Strong muscles enable you to walk better, get up out of chairs better, get in and out of cars better, and most importantly, decrease your risk of falls. So these are just some other benefits pointed out in the bullet points. I'll go ahead and read them. The first one says increases lean body mass and age-related muscle mass and strength loss, improves muscle function, improves endurance, reduces disability, decreases common symptoms and progression of many medical conditions, improves and maintains bone loss, improves quality of gait and gait speed, reduces fall risks, and decreases pain. So how do you know if you are strong enough? Your rehab department offers Thrive screening events frequently throughout the year. Unfortunately, since COVID, we have been unable to do a public screening. However, we are still conducting these screens privately, one-on-one with one of our therapists. So if you are interested in a Thrive screen, you can reach out to the therapy department, giving Stephanie Weiss a call, and we can definitely set up a Thrive screen with you. Our goal for our Thrive screen is that every resident to go through the basic series of 6 screening tests annually. These are screens that have been proven to be statistically predictive of falls and disabilities. The tests that specifically address strength include sit-to-stand tests, grip strength test, and gait speed test. If you cannot stand up from a chair without the use of your arms due to leg weakness, you are at a significant risk of falls and losing independence. Things like joint pain, muscle fatigue, or poor posture can also be signs of muscle weakness. Consult your physical and occupational therapist to see if a full individual evaluation might be worthwhile. Most therapy is covered under your medical insurance. So, what is osteoarthritis? A problem which nearly affects 27 million Americans. We will be reviewing what osteoarthritis is, why it can be painful, and how it is treated, including the importance of strengthening and flexibility exercises to manage the pain and maintain function. Are you living with the pain of osteoarthritis? There are many things you can do to manage the pain and maintain your ability to lead an active life with friends and family. What is osteoarthritis? It is the degeneration of cartilage and sometimes even the bone within a joint. Joint cartilage is the cushion between the bones that make up your joints. It is the blue sections in these pictures. This cartilage, along with synovial fluid that lubricate the joint, which is the light peak sections on this picture, allow your joints to bend and straighten easily without any pain. As you can see by comparing the normal joint on the left in this picture to the arthritic joint on the right in this picture, osteoarthritis causes the cartilage to erode so that the bones have no cushion, and the fluid is therefore squeezed out, which results in the bones rubbing against each other, causing pain and stiffness. It's sometimes referred to as bone on bone. Osteoarthritis is most common in weight-bearing joints like the hips, the knees, the spine, and the thumb joints. Causes of osteoarthritis. With aging, the water content of cartilage increases and the protein makeup of cartilage degenerates. This degeneration is caused by flaking or forming of tiny crevices in advanced cases. In some cases, there is a total loss of the cartilage cushion between the bones of the joints. Loss of cartilage cushion causes friction between the bones, leading to pain and limitation of joint mobility. Damage to the new cartilage can also stimulate new bone outgrowths called spurs to form around the joints. Obesity is the most powerful risk factor for osteoarthritis of the knees. Crystal deposits in the cartilage can cause cartilage degeneration and osteoarthritis like gout or RA. Other inflammatory conditions of these joints lead to joint damage and eventual degeneration of the cartilage and osteoarthritis. Some people are born with abnormally formed joints, which is congenital abnormalities. These people are vulnerable to mechanical wear, causing early degeneration and loss of joint cartilage. Hormone disturbances such as diabetes and growth hormone disorders are also associated with early cartilage wear or secondary osteoarthritis. So as you can see here, primary osteoarthritis is usually caused by repetitive use, genetics, and age. Secondary osteoarthritis can be caused by obesity, repeated trauma or surgery, congenital abnormalities, gout, rheumatoid arthritis, diabetes, spinal deformities, and other hormone disorders. Symptoms of osteoarthritis include pain with repetitive activity, swelling, warmth, creaking of the affected joint called crepitus, and joint stiffness. Symptoms can vary greatly from one person to another, and there is no direct correlation between changes seen on an X-ray and pain. Pain usually worsens later in the day after repeated use. Long periods of inactivity, like sitting in one spot for a long time, can also increase pain. Sitting in a theater or taking a long car ride can cause stiffness and pain. And in advanced cases with complete loss of cartilage, causes friction between joint surfaces, causing pain at rest and limited range of motion. So these are just some symptoms that are correlated with osteoarthritis or OA. You can get that clicking or cracking sounds. The symptoms kind of worsen throughout the day. You might have some mild swelling. Asymmetrical kind of pain So it can affect one side of the joint and not the other, or one side of the body and not the other. Stiffness, pain, bone spurs can develop, which also reduces your flexibility, which makes it hard to bend down to pick something up off the floor or climb upstairs. The blue arrows on this x-ray picture on the left show that normal joint space in a knee, compared with no joint space on the right where you see the red arrows. This x-ray shows changes with narrowing of joint space, spurs, and loss of cartilage. These type of changes in the joint are what causes stiffness and pain with movement. On the right side of the slide, you see a normal spine and then an osteoarthritic spine, You can see how the arthritis can cause bone spurs and narrowing discs, which can also irritate the nerves as they get pinched between the bones. So on the left side, you can see in an x-ray, there's a nice little space in between, a little kind of black space that looks like a wave. And on the right with the red arrows, you can see that that kind of black space is totally gone. Same thing with the picture of the spine on the right-hand side. You can see how you can see those pink discs pretty nicely on the little left picture. And on the osteoarthritic spine on the right, you can see how that there's deterioration in those little pink discs, and you can see how the bone is not as smooth as the one on the left. So treatment and care. There are some very good treatments and interventions available for osteoarthritis or OA. As with most things, being proactive and maintaining strong muscles and flexible joints will decrease the pain and stiffness associated with osteoarthritis. Strong muscles and good posture help to protect your joints. Medications can help with pain and inflammation. Active lifestyles, proper nutrition, and sleep can also play a huge role in managing osteoarthritis. If the OA becomes severe, steroid injections are sometimes helpful. And finally, there are joint replacements and in sometimes cases joint fusions, which are more of a surgical approach to arthritis. Protecting your joints. Even though you may not feel like doing it, exercise is the best thing you can do to relieve arthritis pain and lessen joint damage. The Arthritis Foundation says that 2 best exercises for people with arthritis are walking and water aerobics. Both are easy on the joints and good for those who are overweight or just starting to exercise. They improve heart health and physical conditioning. Consult the rehab department in your community, as ACTS therapists are specially trained to develop safe, effective exercise programs for people living with OA. Physical and occupational therapy can be very beneficial in helping decrease pain and improve mobility for those with osteoarthritis. Effective, safe strengthening exercises for the muscles surrounding the arthritic joint can provide extra support for the joint, similar to kind of wearing a brace, but even better. Additional treatments that can be beneficial. If you are carrying some extra weight, this puts even more stress on your hips, knees, and spine. It is especially important to try to maintain a healthy weight and lifestyle. Medications and supplements can also be helpful, but should always be reviewed and discussed with your doctor. Alternative treatments like acupuncture, Tai Chi, meditation, massage, or even Reiki can be helpful. Your physical and occupational therapists also have many modalities that provide heat or cold therapy, electrical stimulation for pain, as well as carry the knowledge to educate effective relaxation techniques and strategies. Often people with osteoarthritis are referred to an orthopedic doctor. An orthopedic doctor has a number of different options he or she may consider depending on the joint severity and symptoms. Arthroscopic surgery is often the first option. This is generally an outpatient procedure and people generally recover quickly. Joint replacements are used when the osteoarthritis is advanced and often other options have failed. Osteotomy is reshaping the bone to modify the weight-bearing dynamics. This is more common in younger people, and sometimes the only final option is joint fusion, which basically is fusing the joint so that there is no movement. This is more common in ankles and backs where the lack of movement has less impact on functional mobility. Recovery from all of these options usually includes some physical or occupational therapy. In the end, an effective strength training program will give you the best outcome for any orthopedic surgery. If you have any other questions about different types of surgery regarding OA, we suggest that you consult your doctor and make an appointment to see what options are available for you. So if you aren't doing something fun every day, or you feel like you are stuck in an old body that just hurts to move, listen up. Although pain may be a normal symptom of OA, it is not a normal part of aging. At ACTS, you have access to a wide range of support and services. Wellness suite with the nurse practitioner and access to nurses and doctors. We have the rehab department with therapists specifically trained to treat and support older adults through the Thrive program and other specialty programs. Fitness programs with a large variety of classes, equipment, and education. Life engagement coordinators offering multiple opportunities to have fun and engage with others. Walking trails and beautiful landscapes throughout many communities. So it's very important, and we can't stress enough, to stay as active as possible. We know that we're kind of limited due to our COVID restrictions. However, you do have fitness classes available to you on the TV, as well as walking paths on the outside of the buildings. Therapy is also continuing, and we have an outpatient gym that is located on the second floor behind the auditorium, in which we are still treating patients. We wear masks, and we ask that you would wear masks as well. Our entire gym is sanitized before and after each person. So if you feel like therapy would be beneficial for you with your osteoarthritis or just kind of global strength training, you can always get a prescription from your doctor or our nurse practitioner downstairs for an evaluation with one of our physical or occupational therapists. If you have any questions about that, you can always just call our rehab department. Here at ACTS, we have a chronic pain management program. Right now, it's on hold due to the COVID restrictions. However, as soon as ACTS starts to open up a little bit more, we are going to return back to this chronic pain management group. So just to talk a little bit about what this group is, it's an 8-week program that combines traditional therapy for pain with a group meeting that meets once a week. These group classes help you learn to control your brain and your perception of pain. We cover techniques that have been proven to reduce pain. You will also learn about medications and alternative strategies for pain management. 75 of your fellow residents across 15 ACTS community have been through the program already. They have reported a 53% improvement in their pain and their overall experience. Again, if you have any questions about our chronic pain management group, you can always give us a call in the therapy department. So this is some resident feedback in one of our programs. Let me try to turn this up so you guys can hear it. Okay, so I know that I couldn't get the video much louder. However, our resident feedback was saying that she actually went through one of our chronic pain management groups and she actually had a very positive outcome. And she's suggesting that if you do have chronic pain management, to reach out to the therapy department to ask if you would be a great candidate for the pain management group. And she, like I said, had a great outcome with it. So again, if you have any questions about it, just give us a call in our rehab department. So what do you do next? We are guessing some of you may have some questions about what you should be doing. There are several things you can do, but right now what we can do is you can talk to your director of rehab about the Thrive program, which is Stephanie Weiss here at the Edgewater location. Right now, we don't have a chat with a therapist going on due to our current restrictions. However, we're going to resume this once we open back up. But again, as I stressed before, you can always give us a call in our rehab department with any questions, and our director of rehab or one of our therapists can answer those for you. And we're continuing to putting on the Thrive screens. Right now, it's not going to be a huge group screen as we normally do, but we are still doing the Thrive screening. You would just need to call our director of rehab to kind of schedule an appointment if you are interested in a Thrive screen, and we can schedule that for you. So right now, we usually have a handout from today's seminar that usually kind of gives you a little bit more information about our Thrive screening events and a little bit of a synopsis of what we reviewed today. If you are interested in this handout, you can always stop by, again, the therapy department, or you can email or call Stephanie Weiss, and our director of rehab, and she can gladly give you a little bit of a handout. And again, like we said, we hope that we can perform our June Thrive event with you guys in person. However, if we are still not cleared to do that, we will film our June and July as well, like this, and post them on the TV. But if you have any questions whatsoever about any of the information given today, whether it's Thrive screening, strengthening, the chronic pain group, or just overall education and options with osteoarthritis, please don't hesitate to give the therapy department a call. You can always make an appointment with us, and we'd be gladly to speak with you. And again, you also have access to our nursing staff downstairs who can also help you along your rehabilitation from osteoarthritis or any concerns you may have with strength. So we hope that everyone is staying safe and healthy and as active as you possibly can. We are keeping our fingers crossed that we would be able to see you guys again soon and be able to give your June rehab seminar for the Thrive next month. And just to keep you informed, our June rehab seminar is going to be on the mind and about your cognitive reserve and how exercise actually influences and helps with brain function. So just something to look forward to, and we hope that everyone's doing well, and we hope to see you soon.